Good morning, everyone. My name is Dr. Colleen Ryan. I'm a burn surgeon from Boston with 25 years of experience in the care of the burn-injured patient. I'm talking to you this morning recreating a talk that was given at the World Burn Conference in Indianapolis in 2015. Our talk is on the social participation of burn survivors, a collaborative project, which of course is the LIBRE Project, and we're going to talk a little bit about the origins of the LIBRE Project and what exactly it is and what it means. Early in my career, there were patients that came in with very, very large burns, and usually it was the decision of the doctor whether or not that person would be resuscitated or not. As critical care grew and as things changed with an evolution in society where patients began to become more important, and rightly so, in determining what their medical care should be, we began to solicit information and desires of the patient and the patient's family in decisions for resuscitation of patients with very, very large injuries. So with this, early in my career, it became obvious that what we needed to do was to have information not just on mortality, but also on what burn recovery is actually like, so that families should be able to make these decisions. So this project had its origin really in life and death decisions in the intensive care unit, and that's where this was born. But actually, as we go along this path, we find that burn recovery, since it's a new population of patients, because truly it wasn't until the mid-'80s where it became regular for people with large burns to survive, we began to really recognize that there's a need to define what burn recovery is. And that if we could define it, then we could develop metrics to measure it. And if we could measure it, then we would be able to actually improve it and to optimize therapeutic interventions. What we really needed to do was to identify what the health needs were for people following burn injury. So we recognized that this was a project that required collaboration. And with myself as a burn surgeon and several of my colleagues, in addition, people from the rehabilitation world, people from the public health world, people that are experts in academic testing, and also the patients themselves were brought together to form a collaborative group which was funded by the National Institute on Disability, Independent Living, and Recovery Research. And this is called the LIBRE Project, which is the Life Impact Burn Recovery Evaluation. In this group, we have Dr. Kazis, who will speak in a few moments. He's a professor at Boston University School of Public Health. Dr. Jetty, who's an expert in academic testing, particularly applying it to health needs. Myself, I'm a burn surgeon from the Mass General Hospital and also the Shriners Hospital for Children in Boston. Dr. Schneider from Spalding Rehabilitation, and of course Amy Acton from the Phoenix Society, really the largest and most effective society of burn survivors. Right now I'd like to open the talk up to Dr. Kazis.
Thank you, Dr. Ryan, and good morning to all of you. I've been a professor at Boston University for more than 30 years, and in recent years have taken an active role dealing with the issue of measurement as it relates to burn survivors, and that, as Dr. Ryan indicates, that's what the LIBRE Project is about. We have an adage in this field, which is if you can't measure it, you can't change it. And in many respects, I think many of you who have participated in the LIBRE project have cast an important vote, either in terms of the focus groups that you were involved in and the questionnaires that have been administered in surveys. When I say a vote, I mean in terms of participating so that we better understand what your needs are and how we can roll that information up and provide empiric evidence as to what the needs of the burn survivor population are. Once we've established that, we can then better understand how resources can be allocated in an efficient way and improve on both the care of burn survivors as well as their course of recovery. So all of this is important in terms of the LIBRE project. Given that it's been now about 6 to 8 weeks since the World Burn Congress, I'm happy to report that there have been 600 completed surveys. So there are 600 of you out there that have participated and cast a vote in terms of what your needs are, in terms of the social reintegration and the track that you've taken in terms of being able to reintegrate into society having had a burn injury. So mortality and morbidity clearly are not sufficient in terms of looking at the recovery of burn survivors, given the technologies that have improved and the interventions, not unlike, say, the SOAR program, that have been so effective in reintegrating burn survivor into the community. There's no formal way to address community reintegration currently, but the LIBRE project aims to address that through surveys that we've already conducted, and we're now developing improved assessment tools for this. There's no current instrument to measure the social impact of burns. So the LIBRE project then is designed to basically provide information that can then go back to the doctor in routine care of burn survivors and also can be used to plan for future interventions that may impact positively upon your burn recovery. The LIBRE project itself includes Boston University School of Public Health, the Phoenix Society, as Dr. Ryan talked about, the Mass General Hospital, where Dr. Ryan is based, and then Spalding Rehab Hospital, where Dr. Schneider is based. The goal of the project is to develop metrics as a way of understanding the social impact of burn injuries in adults, to develop metrics for measuring community reintegration, and that's why we conducted focus groups and we've developed the surveys that we've administered to 600 individuals. And we're very pleased that we've had such a positive response from many of you that are out there. And then this is to develop a computer adaptive test, a measurement tool that can be put up on a computer or an iPad in the future, and that will allow one to be put on a metric in real time, either during a clinic visit or during particular interventions in the future. The CAT administration, or the computer adaptive test, is not unlike what I'll take as an example, the GRE exams or SATs, where there's an item pool behind the scenes, and then we develop the metric on the basis of responses that the individual gives to each item, where your response to one item will inform the system in terms of what the next item to be given is. And given that only a few of those items are asked of what is an extensive item pool, one can then, with reliable precision, put that individual on the metric. That we call a computer adaptive test. So over the many months, and the project is a 5-year project, and we're now beginning the 3rd year of the project, there were many ideas that came out of the project. And those ideas came from you, from the burn survivor, and from folks that are active within the Phoenix Society, to provide us with information that I think is most relevant to the recovery of the burn survivor. The study timeline involves several goals. In the first year, we created the item pool through focus groups of burn survivors. And the burn survivors of New England, I want to recognize, were also quite important in the success of the project, as well as the Phoenix Society. We field tested the item pool in the second year of the project, and that included the 600 surveys that we've now completed, with 600 burn survivors that participated. We are then going to undergo the science in the third year, where we develop the metric, or the metrics. And then finally, we plan on pilot testing the CAT, the Computer Adaptive Test, in the field, both within hospital settings as well as out in the community. And then last, the dissemination of the metric so that all of you out there will have an opportunity to use the metric, engaging your recovery and return to the community. The conceptual framework, or the framework for the project, involves several particular areas. One is work and employment and the importance of returning to work in the recovery of the burn survivor. Domestic life is the other. And then community, social, and civic life, which involve recreation and leisure, and relating to strangers, which we found to be themes that came up in our focus groups that you, in fact, mentioned. And then interpersonal relationships of family, and then informal relationships of friends, neighbors, and one's peers. Finally, intimate relationships that include both romantic and sexual relationships are themes that came up as well in the focus groups. So this is the framework, and these are the areas that the metrics are going to be constructed around. And then we will be able to put the burn survivor on the metrics for each of these areas. So where are we so far? We've completed the focus groups. We've conducted cognitive interviews in developing the item pool. And then we had a survey of 192 items. And we've now completed 600 questionnaires. 600 different burn survivors completed these questionnaires. At the time of the meeting, we had 463, the World Burn Congress. But since then, given the enthusiastic response we've had from burn survivors, we were able to reach our goal of 600. This is a wonderful thing, and we all want to congratulate the burn survivor community for making this possible. So the use of the CAT, the Computer Adaptive Test, will allow us to establish these new metrics and then to implement them in the burn community, which will also involve the use of the metric in the future at the World Burn Congress, where we'll be able to evaluate the impacts that so many of you have discussed in the past as to how the Congress itself has impacted upon your lives. So we will be able to evaluate that to provide a metric. We also will plan on evaluating the SOAR program and other therapeutic interventions. The other is that we propose that the CAT will be used as a metric when a burn survivor sees a clinician or, in fact, engages in a particular intervention. So one of the study questions has to do with the feasibility of such a metric, what we call a patient-reported outcome measure, using a digitalized metric that is on a computer. And I think many of you have already indicated through your response to our 600 questionnaires that, in fact, it is possible to do this. And given that we're going to be developing a shorter metric, it probably will be even more feasible. This is just an example of the iPad CAT if you're following the slides. But this will be, in the future, put on an iPad. So in fact, the ability to administer the questions will be easy in either a clinic setting or at the time of an intervention. And the whole idea, I think, of the LIBRE CAT is to engage burn survivors so that, in fact, what we're doing can be as close as possible to what, in fact, is occurring in the real world. So we're looking for what was in developing this in your own experiences, which in fact were used then to develop the item pool for this. So the current steps are in the development of the computer adaptive test, and within a year we will be completed that, and we will be launching the CAT in ways that many of you will be able to experience completion of such a metric, and we'll look at the impacts that that might have. Future directions involve training clinicians and burn survivors in the use of the LIBRE CAT and then disseminating it into routine clinical care nationally. We plan on utilizing this, again, to evaluate burn-specific interventions at places such as the World Burn Congress and burn camps and the SOAR peer support groups, which have been so effective. This will provide solid empiric information as to the success of these programs. So finally, we're looking here at our pictures of our cats, and the fact is that these can be easily administered. How can we best apply the CAT in the real world? How can it best be used for your personal burn recovery? Are there other things that need to be measured related to your burn recovery so we can improve it? All of these questions, I think, are currently being addressed, and we'll have better news about the accomplishments of the LIBRE Project in the future related to this. So, Dr. Ryan, would you like to have any parting words?
No, it was just a pleasure to be at the conference, and we really greatly appreciate all the burn survivors that have participated in this meaningful work. Thank you very much.
Thank you all, and again, you are so important to the success of this project.